Jumping back to the sperm banking, why is it not a good idea to do it after chemo starts? And what kind of effect does chemo have on the sperm?
Yeah, it's a great question. So chemotherapy works by disrupting the growth and division of cells while they try, they're relatively, wanted to be targeted. That's why certain chemotherapies work for certain cancers as opposed to others. But in general, they're not very specific. And so any cell in your body that rapidly divides is going to be affected. That's why you lose your hair, because your hair cells are dividing. That's why you can slough some of your intestinal lining and get the diarrhea and the nausea, because those cells rapidly divide. That's why it can affect things like your fingernails and so forth. Anyway, similarly, one of the areas in your body that are rapidly dividing cells are these germ cells. So they're extremely sensitive to chemotherapy, regardless of what kind of cancer you have, what you're being treated for. But in testis cancer specifically, it's the same reason why it kills the testis cancer cells. It kills the pre-sperm cells, those germ cells. So it really damages those cells and their ability to divide and grow. And so essentially, once you've gotten it, any of those sperm that are in the process are going to be wiped out or so affected that you wouldn't want to use those cells to have a kid because of potential risks there with birth anomalies. Fortunately, about 80 to 85% of guys after traditional chemotherapy for testis cancer, BEP, will recover normal sperm function after about 2 years. But you don't know, right? You don't know if you're part of that 85% or part of that 15%. And once you started chemotherapy, that process has happened. So it's a little different than in women, where sometimes even after they've gotten chemotherapy, they can harvest an egg or even a whole ovary, because the way that ovarian follicles develop is different. They're kind of already ready when a woman hits post-puberty. All the eggs she's ever going to have are developed. So the chemotherapy doesn't affect it because it's not dividing that same way. So it's a difference between men and women in that sense. But your question earlier about the timing of it, I have guys do it before orchiectomy. The andrology lab will say, we got a ton of great sperm, no worries. Or they'll say, we got some, or maybe even none. Let's try again after orchiectomy. So we try again. But, if some is good, more is better, in my opinion, right?